before I end this big debate, I also have with me spokesperson of the WHO joining me, Dr. Margaret Harris, World Health Organization spokesperson, who's joining me this evening. My question to you, Margaret Harris, is there's an interesting dichotomy that's being seen here in India. While several states and cities are seeing restrictions on citizens, there are politicians who seem to be going out there in crowds, because in India it's a festival of democracy virtually every time in the year, and there are political rallies that are going on. How do you see this? Are these events risk of becoming super spreaders?
So I think I would just repeat what the Director General said a couple of weeks ago before Christmas. And he was talking about, again, our big gatherings that were likely to happen during the Christmas period in Europe and around the world. That at this time with Omicron, think about deferring, postponing. It's better to postpone a big event now rather than grieve, that we can do these things later when we've achieved what we need to achieve right now, which is to bring the transmission down, protect everybody in society, and then have all our events to mark what we've all achieved together.
But many people feel, Dr. Harris, that if you're wearing your mask, if there is enough social distancing, then it's okay, and you're vaccinated, then it's okay. Is that a correct impression in the wake of the Omicron wave that we're seeing across United States, where 4 lakh in a day or thereabouts are the number of cases, France, UK, where numbers are rising? Is it okay to believe that if you're wearing a mask and continuing social distancing, it's all right?
Every country does make their own decisions according to how their community functions, but it is more difficult. And remember, you are bringing people in from all sorts of places, so you're increasing what we call social mixing, that each individual in a large gathering is exposed to other individuals who may well be bringing the virus in. We have seen many such super spreading events.
So are you saying that you would advise against such large gatherings and crowds? Am I right to believe that?
These are decisions that your politicians will take, but certainly we are in a new and innovative world, and let's use the new ways to reach each other and influence each other for the betterment of all of us.
Do you think across the world, the situation that's currently prevailing, are we on the cusp of the third wave, or is it already here?
Definitely. We are seeing, as my Director General said yesterday, a tsunami of cases, particularly driven in Europe and the USA, in the Americas. But also we are seeing this around the world, in every region. In
India, you said that vaccination is the only way to protect people. In India, we still have a 30% adult population that remains to be vaccinated. Do you think that's going to be leaving us in a vulnerable situation?
Certainly, it's critical to get those people vaccinated as quickly as possible. We see the greatest impact in vaccinating those people who've yet to have their first dose and getting at least those first and second doses into all those people. Currently, the vast majority of people who are in hospitals and who sadly are dying are people who've not yet been vaccinated. So this is something critical to save those lives. We don't want to lose any more people.
Well, the question I want to ask you is that there is still a mixed opinion here in India on whether the booster dose should be part of a cocktail, or should it be the same vaccination that has been the first 2 doses. What are your views on this? Do you think it should be a cocktail approach, or should it be a pure approach of the vaccination already been taken? In terms of efficacy, what would you recommend?
Yes, we've certainly had our strategic advisory group of experts on vaccination looking at this very carefully. And they have found that you can have a different vaccine as your extra shot. But look specifically at what you've had and which vaccines you may be giving differently, and look at all the research on that. So it's not like that you mix and match everyone, but a lot of them we are seeing good evidence now that you could add a different vaccine as a booster, and that will be efficacious and safe.
Dr. Harris, I want to ask you, you've said that the Omicron variant is a variant of concern, but not a variant of alarm. With the fact that even 2 doses of vaccination are not seemingly preventing Omicron infections, would you still maintain that?
So we're certainly seeing that vaccination is keeping people from getting the most severe forms of COVID-19. And that's crucial, because the people with the severe illness are the ones that fill up the hospitals and are the people who die. So our number one aim is to stop people from getting the severe illness. And of course, we don't want any more people to die. The issue you raise is very important, because yes, you should get vaccinated, but you need to do the other measures as well. You need to look very seriously at physical distancing, not getting close together, looking at ventilation in homes and spaces and workplaces, so that the stale air doesn't stay in the room. So fresh air comes in, stale air goes out. These things are making a very big difference. Also wearing the mask whenever you're in a closed space or when you're in crowds. All these things are making a very big difference. So it's not vaccination only, it's vaccination plus all the other things.
Well, Dr. Harris, the last question that I want to ask you is, you're seeing the numbers the way they are growing in the United Kingdom, in the United States of America, close to 2 lakhs in UK alone per day. Do you think lockdown is something that would be imperative in times to come to stop the spread that we're seeing, the exponential spread of the Omicron variant COVID infections?
So we as WHO would prefer to see people able to maintain as normal functions as possible while taking the precautions. So we don't like to see lockdowns. No, we understand that governments get to a point where their health systems are overwhelmed and they've run out of options. But we prefer to see everybody in the community at every level taking all precautions to keep the transmission down as much as possible so society can keep going. So many people are in the informal economy around the world. They rely on being able to get out and work, but do that so they can do it safely. It's a combination of protecting your health, but also protecting your livelihood.
Well, thank you, Dr. Harris, for joining me tonight on the Newshour. Very valuable information, and prevention, the only way to go, which is what we've been talking about all along. The key to COVID spread and its prevention lies with us only if we take precautions. Well, on that note, as I say thank you to you. Thank you, dear viewers, for joining me. And remember, it is in our hands. We need to take precautions, wear our masks, keep social distancing, and stop going to large gatherings, which will be the super spreaders. And we need to keep away from that. Thank you and good night. I'll see you tomorrow.